It's an honor for me to be here and talk to you. Just to tell you, I have no booths, I have no product to sell you. The only thing I have to give you is hopefully knowledge. And that was a great introduction. I couldn't have paid for anything better. Anyway, we've got a lot of material to go over. And as you can see, I'm from the Institute of Regenerative and Molecular Orthopedics. Now, this is what I call the Holy Triad. Anything that we're going to do here is going to basically be involving stem cells, growth factors, and scaffolds. And that's basically the gist of our studies here. Now, basically we're undergoing a revolution in the biologics. And what we find is, I used to be over here, basically, I don't know where my pointer is here, but anyway, I used to be over there on the right side. Now I'm getting my patients better without going to the OR. I mean, I still do some surgery, but it's curtailed quite a bit. Now, this is a very good saying. The more we know, the more we don't know. So I'm hoping at the end of my talk, you're going to know more, but no less. And this is a very good saying for platelet-rich plasma. The more I learn about it, the more I don't know about it, because it's a very complicated topic, as are stem cells. I probably know more than I did a year ago, but I know less. So anyway, let's talk about a PRP. Very important subject. Basically, a PRP has platelets, it has neutrophils, it has macrophages, it has fibroblasts. Fibroblasts, very important. Why? Anything that you guys are going to do, be it aesthetics, be it orthopedics, you're going to need to build collagen. If you're going to try and get your patient to do better, you've got to build collagen. You have endothelial cells. Remember, stem cells are like an army. An army needs a supply line. The endothelial cells give them that blood supply. You have keratinocytes. And guess what? You also have primitive embryonic-like stem cells. And that's a very important thing. In a very good PRP, we have some stem cells there. And that's something that's very important. A good quality PRP is going to have that. Now, what is basically an effective PRP? If you guys are going to do a PRP by using some glass test tubes, please do me a favor and get out of this field and do something else. Just do maybe bioidenticals or something, because you're not going to get the good results. That's why we see a very broad spectrum in the literature about how PRP works. Some studies no better than placebo, other studies it works phenomenally. And it's basically because we don't have a good definition yet as to what a PRP is. But PRP, basically, let's try and give a definition. We need a platelet concentration to give us basically between 1.5 and 3 million platelets per microliter. That gives us angiogenesis, the name of the game. Most injuries that don't heal because they don't have a good blood supply. We've got to create a blood supply. Now, the interesting thing is, I'll show you on the next slide here, if we get too many platelets, guess what? We get inhibition. But the good news is there's no system out there that can give you too many platelets. So it's pretty much a moot point. But you can see there, those of you that are doing what I call the LD PRP, that's basically test tubes. You're getting very low quality PRP. You're not getting many stem cells to grow. Now you see if you do the HD, what I call the high quality PRP, you're going to get way more in the way of stem cells to grow, and you're going to get a better result. Now, there's some people that say you don't need to use white blood cells in a PRP product. Baloney. This literature is there, overwhelming how important these white blood cells are. Why? Because of the fact that you can see from this slide, when you get rid of your macrophages, you have almost no stem cell activity. The macrophages send out signals to these stem cells, hey, there's a problem here, you need to go here and get things done. So that's what's important about that. And so you want to have a PRP product that has your white blood cells. There's other little tricks we have with the white blood cells also that we'll get into in a little while. Now, basically, the power of the platelets is the cytokines. What are the cytokines? Well, the cytokines basically are something like this. I'm going to take it out of my pocket. The body's cell phone system. Okay? This is how the cells communicate with each other. Every topic we're going to hear in this meeting this week depends on cytokines. Any medical topic, any disease is basically an imbalance of the cytokines. What we're attempting to do as physicians to get them balanced again. And we can do this with stem cells and PRP because most of these conditions we're treating are an imbalance of cytokines. The bad guys are outweighing the good guys. So cytokines are so important. Now, what are cytokines? Basically cell signaling molecules made out of protein. Now, they basically are the intracellular communication. This is where it's at. We're down to the basics of medicine. And they can be proteins, peptides, or glycoproteins. Be what they are very important. Now, another important aspect about the cytokines, as it is with stem cells, they function in 3 different ways. They can function like an endocrine system, where one set of cells affects a very distant set of cells. They can be autocrine, where basically we have the cells affecting themselves. And most importantly, they can be paracrine, where they affect the neighboring cells. That's how the majority of stem cells work. That's how the majority of our cytokines are working. They're affecting that neighborhood of cells. Think of maybe the stem cells as like a Navy SEAL strike team. They're going in there, they're securing an area. They're not going to be able to hold on to it for long, but they're getting an area secured so that regular army can come on in. And that's what stem cells do by a paracrine function. Now, here we see an inactivated platelet on the left and an activated one on the right. When it's activated, it looks like an amoeba.